My first guest is Dr. Hal Skinner, interventional cardiologist, and tennis player extraordinaire Paul McElwain. All right, Hal, tell me what happened, Dr. Skinner, with sudden cardiac death.
Well, sudden cardiac death means the heart starts beating so fast that it can't pump any blood, and several different causes of that. The most common is a heart attack, but it can happen from a scar on the heart from a previous heart attack or other entities that cause a weakness and scarring of the heart. So when it starts beating so fast, it can't pump blood, and then no blood to the brain, and you pass out within a few seconds. And if you don't get shocked very shortly, that's going to be fatal.
And you're a good example that it's not fatal.
It can be recovered from. We were playing tennis on, it was a Monday night, March the 6th, as a matter of fact, 7 weeks and 1 day ago, and switching sides of the court, and I felt flushed and a little bit dizzy, and bent over, put my hands on my knees to try to catch my breath, woke up an hour later in the cath lab.
So tell me what happened. When did you see him go down?
Yeah, I saw the corner of my eye that he'd gone to the ground. I figured he just stumbled and realized that he was kind of seizing and wasn't waking up, and blood was gushing out of his head from where he hit the tennis court. So I rushed over and rolled him over. He had no pulse, and knew then he was in a full-blown cardiac arrest, and knew the tennis club had an automatic defibrillator, an AED, in the clubhouse, and I started CPR on Paul, so massaging the chest, making the heart pump blood, and somebody went and grabbed the AED. Another person called 911, and we got the AED and applied it to him and gave him a shock, then we got his pulse back. So that's how that happened.
Well, it was really great that you happened to be playing tennis with a cardiologist, but what if you weren't a cardiologist? I mean, can anybody use an AED?
Anybody can. So when you see somebody pass out, the most common reason to pass out is going to be a sudden drop in blood pressure. So if a patient is still breathing and you have a pulse, then that's a different story. But if they're not breathing and there's no pulse, it usually means ventricular fibrillation, cardiac arrest. Start CPR, have somebody call 911. That is the key to get EMS there quickly. And if there is a place where you have an AED, it is easy to use. It's self-explanatory. You just take the patches, which have a wrapping, you'll pull it off, you apply it anywhere on their chest pretty much, and then it reads the heart rhythm, and it will tell you, it will say shockable rhythm or not. If it says shockable rhythm, you push the button and it shocks them. So it's pretty simple, but it does take a little thought ahead of time to be prepared. And so it's something we can get some education out in the community to inform people how to use a defibrillator and when it would be useful.
All right, now, Paul, did you have any risk factors? Did you have any idea that this could happen to you?
Well, I'd had 2 previous heart attacks, and I have a stent in the lower part of the heart, but the last one had been in 2004. I'd quit smoking in 2005. I had recently lost 40 pounds. And so you would think that everything was moving the other way. I had played earlier in the evening, but as a matter of fact, I was a substitute for the match I was playing in when the event happened. So in terms of the regular risk factors, I was trying to mitigate those and was doing pretty well with it. And this one just right out of the blue.
Well, how he mentioned some risk factors. Are there any certain specific things that if you, as a patient, experience that maybe you should see your cardiologist?
Well, sure. So if you have symptoms that are concerning, so chest discomfort, there's many reasons to have funny feelings in your chest, but the worst is the heart. If you have shortness of breath, that can be the heart. Of course, it can be the lungs as well. But if you have a family history of heart disease, if you smoke, if you're a diabetic, those are huge risk factors: high blood pressure, high cholesterol, and a lack of an active lifestyle. So if you have anything that's concerning, you should see your physician, because heart disease is very treatable if we diagnose it. And there's lots of diagnostic testing to give us answers.
You mentioned diagnostic testing. You need to see your doctor before you start to exercise, before you start to play tennis.
Right, because if you have an underlying significant condition, you're putting yourself at risk. So if there's any question, basically they'll start out with the stress test to assess the aerobic capacity of your heart and then go from there.
Not a bad idea to learn CPR, too, for anybody.
Basic CPR saves lives, and it's basically pressing on the chest, a couple presses every second. That gets blood flowing. That buys you some time. Anybody can do that, and CPR classes are common through the American Heart Association and the health department, etc., hospitals, but anybody can do CPR and should know how to do basic CPR.
Well, I thank you guys for coming in. It's a great story. It's a great outcome. I really appreciate it, and I appreciate you providing the information to the folks out there. Thank you so much.
Thank you, Jeff.